If you're pregnant, especially with your first baby, please watch this. It's what I'm trying to convey all the time.
C-sections are the most common major surgery performed on human beings. Over basically one generation of moms, the C-section rate has gone up by 500%. The problem is that your number one risk for having a C-section might be which hospital you go to. That's what wakes me up in the morning. I'm Neel Shah, an obstetrician over at Beth Israel Deaconess Medical Center. A lot of people don't realize the full magnitude of the problem with C-sections. Basically, in the late 1960s, early 1970s, C-section rates were about 5%. And then all of a sudden, the C-section rate starts to skyrocket. Not just increase, but skyrocket. So before the end of the century, the C-section rate goes up to 1 in 3. And we don't really have a great idea why this is happening. As a surgeon myself, it's hard to believe that 1 in 3 human beings needs major surgery to be born, but that's sort of where we are right now. And the consequences are significant. So things like severe infection, hemorrhage, organ injury. In addition to $5 billion of spending annually, we're talking something like 20,000 major avoidable surgical complications that we're seeing from C-sections we didn't need to do in the first place. I was really puzzled when I first started this job, thinking, like, what can we possibly do about this? Epidemiologists, economists, policymakers, lots of people have been thinking about this for a long time. The clue for me was the fact that across the country, C-section rates vary from 7% to 70% by hospital. If hospital performance is so uneven and it's not explained by patient risk or patient preference, that means the hospital itself could be a risk factor. All of our projects right now are actually trying to figure out what makes Hospital A different from Hospital B. What we've seen is that oftentimes the labor floor is in kind of like a almost forgotten about corner, and it just doesn't get a lot of investment or attention from the hospital. When we visit a bunch of different hospitals, we realize that they're laid out very differently, and that might matter. For example, there are no rules for how many labor floor rooms you should have based on the amount of patients that you see. The place that does twice as many deliveries also does way more C-sections. The only way that's possible is if they're moving people through much faster. Almost all labor floors seem really tight on resources, so the idea is when you have a huge surge in patient volume, how do you flexibly recruit more rooms? How do you bring in more staff? Do you report C-section rates back to your doctors? Like, I have no idea what my C-section rate is until somebody tells me. You know, we're testing this hypothesis that management matters in childbirth just the way it matters in every other industry. We're starting to parse differences among C-sections. So rather than looking at all C-sections altogether, we're trying to just take the lowest risk women and focus on their C-section rate. As soon as you start to do that, two things happen. Insurance companies start to pay attention, and then just women start to pay attention. And I actually think this is an area where women's views on this are probably going to be the driving force behind the change. There's really no other moment in people's life where they're so discerning as when they become pregnant.